When's the last time you woke up naturally with a firm erection? Not last week, not last month. Maybe you can't quite remember. And somewhere between then and now, you told yourself what most men tell themselves. I'm just tired. I've been stressed. It'll come back on its own. But it didn't. I'm Dr. Neraya Wolfe, urologist and pelvic surgeon. And what's happening in your body right now has a real explanation, one that most men never receive. Today, I'm going to give you that explanation. Here is the most important thing I need you to hear before we go any further. This isn't aging, it's depletion. And depletion can be fixed. The explanation most men receive, when they're brave enough to bring this up at all, is simply, it's part of getting older. And I understand why doctors say it. Time is short. The appointment ends. You walk out with no real answers. But that explanation is incomplete, and in many cases, it is flat out wrong. Today, I'm going to walk you through the 5 real biological mechanisms driving erection changes in men, the ones that rarely surface in a 10-minute appointment. And more importantly, I'm going to show you exactly what you can do about each one. Stay with me through this. What you learn today may genuinely change what you decide to do about your health. Before we get into the causes, let me give you a foundation that will make everything else make sense. An erection is not a simple event. It is a coordinated process. Your nervous system, your cardiovascular system, your hormonal environment, and specific muscle groups all working simultaneously. When those systems communicate well, erections happen naturally, reliably, without conscious effort. You don't think about it, it just works. When even one of those systems begins to falter, blood flow restricted, hormone signals dimmed, nervous system under pressure, muscles weakened, the whole coordination breaks down. And the result is exactly what so many men experience: erections that are less reliable, less firm, harder to sustain, or simply absent when they should be present. Here is the reframe that I want you to carry through this entire conversation. This is not a story about age. It is a story about systems, and systems can be assessed, understood, and supported. There are men in their late 50s and 60s with excellent erectile function. There are men in their late 30s with significant difficulties. The difference is almost never the number on their birthday cake. It is the state of the systems inside their body. And those systems respond to what you do, what you eat, how you sleep, what you carry emotionally, and yes, whether anyone has ever told you which muscles to train. Let's talk about what's really going on. Because number 1, vascular health, the blood flow story. Nobody tells you fully. Every urologist knows this. Most will mention it in passing. Few explain it in a way that makes it feel real. So let me try. An erection is, at its core, a vascular event. Blood flows into 2 sponge-like chambers inside the penis, the corpora cavernosa. As they fill, they expand and pressure builds. For the erection to be firm and lasting, that blood needs to arrive in sufficient volume and remain there. Now here's the part that changes everything. The blood vessels supplying the penis are among the smallest in the body, roughly 1 to 2 millimeters in diameter. The coronary arteries supplying the heart are 3 to 4 millimeters. Think of your vascular system like a household plumbing network, the pipes running to the major organs. The heart, the kidneys, are the main lines, thick, resilient, the pipes running. To the penis are the narrowest lines in the entire system. And narrow pipes show damage first. Calcium buildup, pressure changes, inflammation, all of it registers there before it registers anywhere else. This is why we in urology and cardiology have come to understand erectile dysfunction as an early warning signal for cardiovascular disease. When a man begins experiencing erection changes in his 40s, research consistently shows that his risk of a cardiac event over the following 5 to 10 years is meaningfully elevated. Not because one causes the other, but because both are being driven by the same underlying vascular changes. Here's where most men miss this. The penis is your body's sentinel. It is telling you something about what is happening throughout your entire circulatory system, and the changes it is signaling are not inevitable. They are modifiable. Diet, exercise, blood pressure management, blood sugar control. These are tools that speak directly to vascular health. And vascular health speaks directly to erection quality. This is not a coincidence. This is biology. Because number 2, the testosterone picture. What your lab results may be missing now. Before you say, I've already heard about testosterone, my doctor checked it and said everything was fine. Let me stop you right there. Because this is exactly where most evaluations fall short. When your doctor orders a testosterone test, they typically measure what's called total testosterone, the total amount circulating in your blood. If that number falls within the reference range, you're told you're fine. Case closed. But here's the problem. A significant portion of the testosterone in your blood is bound to a protein called sex hormone binding globulin, SHBG. And when testosterone is bound to SHBG, your body's tissues cannot access it. It is present on paper, unavailable in practice. What actually matters is free testosterone, the unbound, biologically active fraction. And free testosterone can be critically low even when your total testosterone looks completely normal. This is a gap I see in my practice regularly. A man comes in, total testosterone within range. He's been told there's nothing to investigate, but when we look at free testosterone and SHBG together, the picture is very different. Beyond the testing gap, testosterone does decline naturally, roughly 1 to 2% per year after 30. By the time a man is in his late 40s or 50s, that quiet accumulation can become genuinely significant. The challenge is that the symptoms, reduced drive, less reliable, erections, fatigue, mood shifts, difficulty building muscle, are easy to attribute to stress, to work, to getting older. We explain them away instead of investigating them. And here's something that rarely gets discussed. Testosterone can be actively suppressed by lifestyle factors that are entirely within your control. Chronic sleep deprivation, consistently under 6 hours, directly impairs testosterone production because the majority of daily testosterone synthesis occurs during deep sleep. Chronic stress drives up cortisol, which is biologically antagonistic to testosterone. Excess abdominal fat contains an enzyme called aromatase that actively converts testosterone to estrogen, depressing circulating levels further. For many men, the path to better testosterone isn't a prescription. It is understanding what is actively suppressing production in the first place and systematically removing those obstacles. Before I continue, if this kind of honest, evidence-based education is what you've been looking for, I'd ask you to subscribe to this channel. Every week we cover the topics most men never receive a real answer to. That's exactly what we're here for. Now, let's keep going, because the next 2 causes are the ones most doctors never mention at all. Cause number 3, the pelvic floor. The hidden structural layer. This is the cause I find myself explaining most often to men who have already tried other approaches. They've cleaned up their diet, they've exercised, their blood work looks reasonable, and yet erection quality is still inconsistent. They don't understand why. The answer, in a significant number of these cases, is the pelvic floor. Most men have no idea they have a pelvic floor. We talk about it extensively in women's health. In men's health, it remains largely invisible, and that is a genuine disservice because it plays a direct and documented role in erectile function. The pelvic floor is a group of muscles forming the base of the pelvis. 2 of those muscles, the ischiocavernosus and the bulbospongiosus, wrap directly around the base of the penis and are involved in producing and sustaining erections. The ischiocavernosus compresses the erectile tissue and is responsible for firmness. The bulbospongiosus compresses the deep penile veins, keeping blood from leaving the erectile tissue too quickly. When these muscles are strong and well coordinated, erections are firm and sustained. When they are weak, which happens with age, with inactivity, with years of prolonged sitting, erection quality suffers, even if blood flow is normal, even if testosterone is adequate. Here's where most men are genuinely surprised. Research published in the British Journal of General Practice found that men who completed a targeted pelvic floor exercise program saw significant improvements in erectile function, with 40% regaining completely normal function. These were not men who needed surgery or medication. They needed to train a group of muscles that nobody had ever told them existed. Cause number 4, the nervous system. Stress, anxiety, and the physiology of performance. I want to speak carefully here, because this sits at the intersection of the physical and the psychological, and both sides of that intersection are completely real. An erection requires your parasympathetic nervous system to be dominant. This is the branch associated with calm, safety, connection, and rest. Its counterpart, the sympathetic nervous system, the fight or flight branch, is actively antagonistic to the conditions your body needs for erection. This is not a metaphor. This is physiology. When the alarm system is active, blood is diverted to large muscle groups for movement. Digestive functions slow. Reproductive functions recede. An erection, in this context, is something the body considers deferrable. Here's where most men don't see it coming. A man has one difficult experience: stress, fatigue, alcohol, any number of things. Instead of letting it pass, he starts to anticipate it happening again, and that anticipation is itself a form of stress, so the next encounter carries an extra layer of nervous system activation. The erection is less reliable, the anxiety deepens, and a self-reinforcing cycle takes hold. Performance anxiety is not weakness. It is a predictable physiological response to a distressing experience, amplified by the culture of silence around men's sexual health. Men are often taught implicitly that sexual performance is tied to identity, to worth, to masculinity. When that performance feels unreliable, the psychological weight becomes immense. The good news is that this cycle, like all cycles, can be interrupted. By understanding it, which is part of what we're doing right now, by working with a therapist who specializes in sexual health, by open communication with a partner, and by addressing the underlying physical factors that may have initiated the first difficult experience. Understanding the physiology is itself therapeutic. It removes the shame, and removing the shame removes a significant piece of the cycle. Cause number 5, medications and systemic health. What sits in the background? This one doesn't get nearly enough attention in the broader conversation, and I want to change that. There is a long list of medications that can impair erectile function as a side effect, and many of the men taking them have either never been told this or were told in passing and didn't fully register it. This includes certain blood pressure medications, particularly older classes of beta blockers and thiazide diuretics. It includes many antidepressants, particularly SSRIs and SNRIs. It includes certain antihistamines, acid reflux medications, and opioid pain medications. I am not telling you to stop any medication on your own. Please don't. But I am telling you this. If erection changes began around the time a medication was started, that timing is worth discussing with your prescribing physician. There may be alternatives in the same class with a more favorable profile. There may be dosage adjustments worth exploring. That conversation is worth having, and you deserve to have it. Systemic conditions also matter significantly. Type 2 diabetes can damage both the blood vessels and the nerves that support erection, often years before other symptoms become apparent. Cardiovascular disease, metabolic syndrome, and chronic kidney disease all affect the systems we've discussed. Thyroid dysfunction, in either direction, can affect hormone balance and energy in ways that reach sexual health. The broader point, your erections don't exist in isolation. They are a reflection of your whole body health. When multiple systems are under strain, that strain shows up here first, because the vessels are smaller, the hormonal environment is more sensitive, and the neurological. Integration is more complex than in almost any other physiological function. Now let me bring all of this together into something you can actually use. Step 1. Get a proper evaluation. If erection changes are affecting your life, the first step is a real conversation with a urologist. Not a rushed mention at the end of a primary care appointment. A dedicated evaluation should include thorough history, when changes started, whether you still have morning erections, your stress and sleep picture, your medications, and any systemic conditions. Physical examination, and blood work that goes beyond a basic testosterone panel, total and free testosterone, SHBG, LH, FSH, blood glucose or HbA1c, cholesterol, thyroid function. Morning erections deserve a specific mention. Spontaneous erections during sleep are the body's way of maintaining healthy penile tissue. Their presence tells us that the vascular and neurological machinery is largely intact. Their absence is a significant clinical signal. If you've noticed they've decreased or disappeared, tell your doctor that, specifically. Step 2. Address the vascular foundation. Regular aerobic exercise is one of the most robustly evidence-supported tools we have for improving erectile function. Not marathon training. Brisk walking, cycling, swimming, 30 minutes, most days of the week. Men who adopt regular moderate aerobic exercise consistently show meaningful improvements over 3 to 6 months. Diet matters, particularly in terms of reducing the inflammation and metabolic dysfunction that damage small blood vessels over time. Whole foods, adequate vegetables and fiber, lean proteins and healthy fats, a significant reduction in ultra-processed foods and refined sugars. Blood pressure and blood sugar control are not optional for men with erection changes. These are the most significant modifiable vascular risk factors. If you don't know your blood pressure or your fasting glucose right now, please find out. Step 3. Evaluate the hormonal picture carefully. If free testosterone is low, lifestyle optimization is always the first layer. Sleep, stress management, body composition, alcohol reduction. These are powerful hormonal levers, and they should be pulled first. For men with confirmed, clinically significant low testosterone, where lifestyle hasn't been sufficient and the blood work clearly supports it, testosterone replacement therapy is an option worth discussing with a urologist or endocrinologist. It is effective when appropriately prescribed and monitored, and it is nothing to be ashamed of considering. Step 4. Train the pelvic floor. Here's the technique. Lie on your back, knees bent, feet flat. Breathe normally. As you exhale, gently contract the muscles you would use to stop urinating midstream, without tightening your abdomen, buttocks, or thighs. Hold for 3 seconds. Release slowly for 3 seconds. That full release matters as much as the contraction. Repeat 10 times, 3 minutes a day. Done consistently over 6 to 12 weeks, this produces measurable improvements in erection firmness and duration. If you've tried this before and it didn't help, the muscle isolation may not have been quite right. A pelvic floor physical therapist, yes, they work with men, can assess your technique and correct it precisely. Step 5. Take the psychological layer as seriously as the physical. If performance anxiety has become part of your experience, treat it with the same seriousness you would give any physical factor. Cognitive behavioral therapy, sex therapy, and couples counseling are evidence-based interventions with real outcomes. Men who pursue them and commit to them frequently describe it as one of the most valuable investments they've made in their health and their relationships. And medication, when appropriate. The oral medications for erectile dysfunction work by enhancing nitric oxide activity and improving blood flow to the erectile tissue. They are useful tools. There is nothing wrong with using them, but they work best when the underlying causes are also being addressed, not as a permanent substitute for understanding what's actually happening. I want you to ask yourself something before you close this video. What have you lost? Not to shame yourself, but honestly, what does this cost you? In intimacy, in confidence, in how you feel in your own body, in how present you've been able to be with the people you love? Because here's what I know from treating thousands of men who have sat exactly where you are right now. The ones who recover, and most do, are the ones who stopped explaining it away and chose to pay attention. The changes you're experiencing are not a verdict. They are a conversation your body is trying to have with you. It is asking you to look more carefully at your vascular health, at your hormonal environment, at the muscles nobody told you to train, at the stress you've been quietly absorbing, at the sleep you've been quietly sacrificing. I have watched men come back from exactly where you are. I've watched it happen for thousands of men, more energized, more connected, more present in their relationships, in their own lives, and it started with exactly what you did today, choosing to seek understanding instead of silence. You deserve comprehensive care. You deserve a doctor who listens to the whole picture. And you deserve to know that what you're experiencing has real explanations and real paths forward. If this conversation gave you something useful today, please subscribe to this channel. We cover these topics every week, the ones most men never get real answers to. And if you want to go deeper, I've left a link above to a video that picks up right where this one ends. Take care of yourself, because you are absolutely worth it.